Good evening and welcome to News 360 from the News Hub here at Adisanwe in Accra. I am Issa Moni.
And I am Aisha Yakubu.
Mothers whose children are taking doses of the first malaria vaccine have expressed delight about the introduction of the Rtss vaccine. Our reporter, Isibinwa Otu, visited one of the child health centers in the Cape Coast metropolis a year after its introduction.
29 years old Anita Odum has brought her 14-month-old baby to the Cape Coast Central Reproductive Child Health Center for the Rtss malaria vaccine.
We're 14 months.
My son is 14 months and has taken 3 doses of the malaria vaccine. Another mother, Cynthia Edu, has also brought her 1-year-old son.
When you're 6 months, I'm 7, 9 months.
My child has taken 3 doses already. Malaria worries children here so much, so I'm excited about the vaccine. The mothers say they initially had doubt about the efficacy of the vaccine.
6 months,
Initially, he ran temperature and I wanted to stop, but the nurses assured he would be okay.
But since then, it's not him that so many pandia about Bonkalan who by malaria. I just was 1 month.
I didn't like it from the beginning. He ran temperature, but it stopped. My son does not get sick from malaria.
It's the 4 months or so more, 9 months more. It's also no year on your baby, one was Nankasangasa.
Between 50 and 60 babies are vaccinated on a clinic day. Elizabeth Dadsey is a senior community health nurse.
I would say that it has really worked because when you go to OPDs, the number of under 5, let's say under 2, because even for those who started, next month that they are going to receive the 2 years. So for the under 2, it has reduced. And once we are giving the vaccine to, we always I tell them that they should continue the preventive measures, which is sleeping under treated net.
In April last year, Ghana and some African countries commenced the pilot implementation in vaccinating children up to 2 years. 1 million babies are expected to be vaccinated in 4 years. The Cape Coast metropolis is malaria prone and 142 communities are taking part in the program.
Half year this year, we have about 3,000 children receiving the vaccine. We have about 3,000 children receiving the vaccine. Though comparing to our target, we've not reached our target, so we are trying to mop out, move from house to house, then get the children who hasn't vaccinated to vaccinate them. We've drawn our itinerary per the communities, go into the community, make announcements, to make the caregivers ready that we'll be visiting them in their homes. So they should make their child welfare clinics ready.
Cape Coast Metro malaria focal person James Edupoko noted the prospects are encouraging.
As at now, it's been in its pilot stage. It's protecting the children against, it's reducing 4 episodes of malaria. So let's say if my child will get malaria 10 times in a year, the number of times you get will reduce to 6 times. And even if this is helping to reduce the number of cases, that means when it is being widespread introduced into the whole country or brought into the EPI, it's going to help reduce malaria burden in the society.
The pilot implementation program is designed to generate evidence and experience to inform WHO policy recommendations on its broader use. AC Benewa Otu TV3, Abease, Cape Coast.